What I want to talk about for this show is basically the ongoing vaccine wars. So, as we all know, thanks to the rapid spread of the Delta variant, COVID cases are rising again in the US. Some cities have reinstated mask mandates, and unsurprisingly, a number of Americans have doubled down on their commitment to turning an unprecedented health crisis into an excuse for a culture war. No, I'm not just talking about right-wing pundits like Tucker Carlson, although, of course, he racks up views and paychecks by stoking anti-mask and anti-vaccine sentiment. I'm also talking about an equally vocal set of self-righteous liberals in the media and the political class who are rushing headlong into the exact same COVID culture wars by displaying their unbridled contempt for the unvaccinated. Now, according to a very popular narrative that's going around at the moment, not being vaccinated at this point in the pandemic can only be explained by stubbornness, stupidity, or conspiratorial thinking. For instance, in a column this week, eviscerating the unvaccinated, the New York Times writer Charles Blow argued, quote, "The simple truth is that all of this could have been avoided if all Americans eligible for the vaccine, and that's pretty much every adult at this point, had simply chosen to be vaccinated. But they didn't. They haven't. They're too dug in, too committed to the lies and conspiracies, too devoted to rebellion." Likewise, the CNN commentator Chris Cillizza had this to say.
The struggle to vaccinate enough Americans against the coronavirus in order to achieve herd immunity has produced frustration, anger, and a whole lot of people doing things directly against their best interests when it comes to their health. Maybe the most upside down, almost hurt my neck, bit of reality that's emerged from the politicization of what should be a public health issue, thanks Donald Trump, is this. The people at the most risk of being infected with the Delta variant of the virus are the least concerned about getting it. A July CBS News YouGov poll paints a stark picture of this remarkable disconnect. Asked whether they were concerned about the Delta variant, the dominant strain of COVID-19 in the United States, and the one that has led to a major surge in cases, almost 3 in 4 vaccinated people, 72%, said they were worried about it. Less than half, 48% of unvaccinated people said the same, which is, and this is a technical science term, bonkers, because, well, science. Quote, "We're seeing 99.5% of deaths right now from COVID-19 in our country are happening among the unvaccinated," U.S. Surgeon General Dr. Vivek Murthy told CNN's Dana Bash on State of the Union in mid-July. And in case you missed it, 99.5% of people who are dying from the coronavirus right now are not vaccinated, which means, because, again, math, that less than 1% of all COVID-19 deaths right now are among vaccinated people.
Now, is it true that the vast majority of new cases are circulating among the unvaccinated? Yes. Is it true that there are anti-vaxxers who are conspiracy theorists, right-wing ideologues, or simply just misguided? Also yes. That said, there's more going on here than just the bad behavior of anti-vaccine fanatics and the tinfoil hat crowd. Recall a poll from a few months back that found that a significant percentage of unvaccinated people said they were concerned about the cost of the vaccine, even though, of course, the vaccine is free. That's not really much of a surprise given our incredibly confusing and cruel for-profit healthcare system, and especially the prevalence in that system of surprise billing and hidden fees. More recently, Kaiser found that uninsured Americans had the lowest vaccination rate of any group that they surveyed. Adding to that, last Friday, the journalist Bryce Covert noted that particularly for low-income people, there still exists a number of barriers to getting the vaccine. As Covert writes, quote, "Those who aren't yet vaccinated are much more likely to be food insecure, have children at home, and earn little. About 3/4 of unvaccinated adults live in a household that makes less than $75,000 a year. They're nearly 3 times as likely as the vaccinated to have had insufficient food recently." And I just quickly want to mention that in Bryce Covert's article, she also includes a pretty stunning chart that, looks at how vaccination rates break down among people who are likely to be food insecure, or, people with kids, or essential workers, or people who earn not a lot of money. And if you go and look through that chart, I think that the disparities are pretty striking. So what does this say about access? Why are food insecure and low-income people less likely than their affluent counterparts to be vaccinated if the vaccine is free and currently available to just about everyone? The truth is, there isn't just one single factor that we can point to as the one thing that's preventing people from being vaccinated. Instead, for so many working class and low income Americans, being unvaccinated is the result of 1,000 different tiny cuts, all of which are inflicted by our bare bones social safety net and our incredibly punitive capitalist system that's set up to make everything as difficult as possible for the poor. For example, the federal government has not mandated that employers give their employees paid time off to go get vaccinated. So if you're someone who's already struggling to pay bills or pay rent or put food on the table, and you know you won't be paid for the work hours that you miss to go get vaccinated, maybe it doesn't seem like it's worth it. Or think about the fact that many vaccine sites don't allow other people to come with you. Both childcare and elder care in this country are notoriously expensive, hard to come by, and certainly not guaranteed by the government. So if you have kids who need to be watched, or if you're a caregiver to elderly or disabled relatives and you cannot find someone to cover for you, it's going to be that much more difficult to find the time to get to a vaccination site. Finally, add to all of this the fact that the vaccine technically has not been approved yet by the FDA, and the CDC has continually changed or reversed their advice about indoor transmission, outdoor transmission, surface transmission, masks, and so much more, and it's not hard to see why some people have reservations. Now, the COVID vaccine is safe and effective, and many people who are hesitant could likely be convinced to come around to vaccination. But simply calling them evil anti-vaxxers who are destroying the country probably isn't going to be a very effective method of persuasion. What's more is that framing vaccination as only a matter of personal choice, rather than a confluence of choice, circumstances, economics, and politics, reproduces the personal responsibility mantra that's so beloved by the right. As Bryce Covert put it, quote, "The current approach is to argue that access has increased and it's everyone's individual responsibility to get a shot. If you don't, it's on you." Once again, we've taken the cruelly American, ruggedly individualistic tactic of making this about personal responsibility, not about a systemic response, just as we did in combating the virus itself. What our government has to do, but is continuing to fail at, is to make it as easy as possible for people to get shots. Yes, on one hand, that does mean rolling out more incentives like offering money in exchange for getting vaccinated, which of course several states have already done. But even these incentives can backfire when local governments introduce unnecessary hurdles into the equation. According to Bloomberg News, at one vaccination site in the Bronx, people showed up expecting to receive $100 in cash or gift cards in exchange for vaccination. But once they were at the site, they were told that in order to get the money, they had to register online for a prepaid debit card, which would be mailed to them at an unspecified later date. As one nurse who was working at the site told Bloomberg, quote, "It actually discouraged people to the point where they don't take the vaccine." Even beyond incentives like money that still ultimately rely on nudges, which is appealing to individuals' behavior, if we want to significantly increase vaccination rates in the US, what we really need are the same sweeping societal changes that the left has been fighting for decades. We can already see that it's an uphill battle to vaccinate a critical mass of people in the US without things like a national healthcare system, paid sick leave and family leave, and guaranteed childcare. Now, of course, it's unlikely that we'll be able to implement these programs overnight, but in the meantime, the government can do things like hold more vaccine drives at places like shopping centers, food pantries, schools, public housing complexes. They can organize door-to-door or phone outreach to talk with unvaccinated people who might have concerns or hesitations. And the Biden administration should push to expand emergency paid leave and childcare so people can take time to go get vaccinated without fear of losing wages or wondering how they'll care for their loved ones. If anything, our policymakers should treat this moment as a sober reminder of what can go terribly wrong when you spend decades shredding the social safety net and instead exclusively promote the gospel of personal responsibility. And finally, for the ultimate lesson in how not to inspire confidence in our ruling class when it comes to the pandemic, we only have to look to former President Barack Obama's 60th birthday bash on Martha's Vineyard last weekend. The event boasted a star-studded guest list of hundreds that included Jay-Z and Beyonce, Chrissy Teigen and John Legend, Eddie Vedder, and Don Cheadle. While some people who had been invited to Obama's birthday party declined and expressed reservations about holding such a large, flashy event at the exact same time that Obama's good friend Joe Biden has been pleading with the public to avoid such gatherings, plenty of other guests in attendance insisted that concerns about virus transmission were, quote, overblown. Here's what some of them had to say.
Other people said, this is really being overblown. They're following all the safety precautions. People are going to sporting events that are bigger than this. This is going to be safe. This is a sophisticated, vaccinated crowd, and this is just about optics. It's not about safety.
That's right. The same crowd that's been bemoaning Sturgis as a death cult and deriding the behavior of, quote, spreadnecks was totally fine with Obama's massive birthday party because it was populated by sophisticated, vaccinated people. The whole affair was reminiscent of when politicians like Gavin Newsom and London Breed were caught dining out at high-end restaurants during the height of the pandemic. That is, right when they were scolding their constituents to stay home. Personal freedom for me, personal responsibility for thee. Just to wrap up, I want to say that I can think of no situation more appropriate than these ongoing vaccine wars to invoke the famous Michael Brooks quote, "Be ruthless with systems, be kind to people." Unfortunately, in this case, as in so many others, liberals have it completely backwards.
And what no one's really talking about is, we know for Jay-Z and Beyonce, since they're in the Illuminati, they automatically don't get COVID. So that's why I just want to provide context. Like, that's why they don't need to vaccinate.
Yeah, I think some of the CNN commentators pointed that out after the clip got cut off. But
right.
You're right.
It was
yeah, that's true. The ruling class is much more likely to reach herd immunity because so many of its members are, of course, in the Illuminati. So right. We must take that into consideration.
That's why here on the Jacobin Show, we give you the real news. But I mean, in all seriousness, what's kind of interesting here is that, for, CNN and MSNBC, the stereotypical Trumper who's against vaccinations, they're going to scold them. But then when it comes to hesitancy among vaccines among Black people, they really are overstating this narrative of skepticism because of things like the Tuskegee experiment. And I'm not denying that that's somewhat of a factor, but I really feel like that's vastly overstated. And I think a lot of it comes back to these factors that you mentioned, which again are going to affect, I think, Black people disproportionately, given that they are disproportionately working class. And, just like you said, to really address this, we would need a much more robust, strong state, a strong social safety net. That really is how we can maybe start to get to address some of this. But it's amazing. So it's like no forgiveness for any of like a white person that's vaccine hesitancy. Then it's like over forgiveness, overstating this narrative of the Tuskegee experiment for Black vaccine hesitancy. And it just really misses the mark on both of those.
Completely agree. And, I think that also gets to kind of one of the core problems with liberalism, which is that in many ways, it's just the flip side of the coin of conservatism, where you think that some people deserve to be winners and other people deserve to be losers, right? So if you're a conservative, the people that you think deserve to be winners are what? Capitalists, businessmen, whatever, business owners, small business owners. And then the people who deserve to be losers are those that didn't work hard, obviously the poor, people who couldn't pull themselves up by their bootstraps. Liberals do the exact same thing. Except, for them, the undeserving poor or the people who deserve to be losers are, in many cases, as you said, these kind of the stereotype of the rural, like unmasked, unvaccinated Trump voter, which of course is code for, a white working class person. And I want to shout out, there was another great piece in the New York Times by Sarah Smarsh, where she talks about what we're talking about now, how among a lot of liberals, there's just a lot of rage, which on the one hand is sort of understandable because, we've been dealing with this pandemic for a year and a half. Everybody hates being inside. It sucks to have to put on a mask again. Right. Again, you see the statistics that COVID cases are rising among the unvaccinated. And I think, lots of people just kind of flip out. And her piece is really great because she acknowledges that frustration and admits that, she gives into it herself sometimes. But at the same time, you really have to look at, I think, where it's coming from and who it is that you're actually blaming. And I think, what was so great about Bryce Covert's piece is that she really does get at some of the economic and societal barriers that still exist to getting vaccinated. Again, like, I just really want to stress, it's not one thing. It's not that, You can't point to one specific thing. It's really just our system is set up to make things so incredibly difficult for the poor. So.
Yeah, and one more point on this. I mean, not to like over glorify Cuba, but one of the inspiring things I've read and heard about with their healthcare system is that the doctors like regularly do home visits to their patients, and there's a really good network set up around that. And I think, you could imagine if a patient, even if they're vaccine skeptical, if they have a close relationship built over time with their doctor or with some kind of medical provider that's always going to their home, I can imagine it being a lot easier for them to persuade them eventually to get the vaccine, when they kind of know and trust the health system. But again, that takes investment and of course, our country being a lot bigger, that program would have to be a lot bigger, but that takes investment, that takes like a belief in the public version of healthcare that we just don't have in this country.
Yeah, something I didn't explicitly mention earlier is that one unfortunate effect of a completely eroded social safety net and, a non-existent welfare state and a government that acts or that treats you as though you're on your own is that really erodes public trust across the board, not just when it comes to vaccines, but for everything, right? So if you look at countries that are basically social democracies like the Nordic states, trust in the government and public trust in just institutions in general is much, much higher in those countries, precisely because they know that their government will take care of them and isn't leaving them hanging out to dry. And I think when, we think about vaccine hesitancy, a large part of it is low public trust, at least in the US. And I guess you could say that that's cultural, but that, again, is a byproduct of a completely eviscerated social safety net. And as I keep saying, a government that leaves you out to dry. If you like this video from The Jacobin Show, please hit like and subscribe. You can also watch the full episode and catch our future live streams by clicking the join button below and becoming a Jacobin YouTube member. Thanks.